Okay, so I'm going to be taking Leah through a little mini kinstretch class. It's going to be focused on the hips. So I will get her to go in a side lying position. We're going to work through some axial rotations here. So what I want her to be mindful of here is to have her pelvis stayed squared forward as we're going through this exercise. I'm going to get her to bend her bottom or her knees up to 90 degrees. I'm going to put a yoga block here to make sure that she's not twisting through the pelvis, and this is going to be her tactile cue. I'm going to get her to either put a yoga block underneath her neck and use an arm, and then she's going to anchor this arm down to support her. So her bottom leg is going to be pushing into the ground. She's going to have tension in her body, and I'm going to get her to open up and lift her knee up to the ceiling, coming into abduction. From here, holding that position, we're going to work through some hip axial rotations. So I want her to bring her ankle and foot towards me from behind, coming into internal rotation, keeping the knee in the same place. And then I want her to transition to external rotation. All the while anchoring down through that left leg, tension in the rest of the body, and she's going to continue moving through a few of these axial rotations on her own. Good. Awesome. From here, we're going to transition into some knee capsule cars. So staying in this abducted position, I want her to start internally and externally rotating through her tibia. So I want her to turn her foot out, moving through the entire portion of her lower leg, not just the ankle. Knee stays in the same place as she transitions. Foot turns inward into internal rotation. Foot turns out into external rotation, keeping this knee high up, anchored through the rest of the body. Coming back into internal rotation. One more time in each direction. Good. And then I'm going to get her to come back into external rotation, and she's going to bring her heel down to her bum. We're going to transition to some knee cars in this abducted position. She's going to turn her foot into internal rotation, straightening her leg up towards the ceiling. Turning out into external rotation, foot turns out, heel finds the bum. Foot turns in, leg straightens up towards the ceiling. Staying in this internally rotated position, she's going to bring her heel towards her bum. Switch, turn the foot out into external rotation, leg straightens. One more time, foot turns into internal rotation, heel finds the bum. Externally rotate and straighten. Good. From here, I'm going to get her to bring her leg down, taking a couple breaths to rest. And then we're going to transition into our hip cars for side lying. So irradiating and anchoring through the rest of her body, I want her to bring her knee up towards her face, coming into hip flexion. From here, without shifting in the pelvis, she's going to open her knee up towards the sky into abduction. She's going to find internal rotation, bringing that ankle towards her from behind as she scoops all the way around. Knee finds the other knee. Good. Anchoring down through that left leg. She's going to kick back into extension, making sure she's not flaring through the low back. Abdomen stays strong. Knee and ankle find the sky. She's going to come all the way up. Knee finds the face into flexion. And she comes all the way down. That's one round of hip cars. She's going to go for one more. Knee comes to the face, opens up, ankle finds her from behind as she scoops all the way around, tension in the rest of the body as the knee meets the other knee. Good, staying strong through the abdomen. She's going to kick back into extension, bringing that knee up towards the ceiling as the knee tries to find the face. Coming into hip flexion and coming down. Taking a breath and switching sides. We'll do that whole series on the other side.
Ooh.
Sorry.
This is a workout.
Okay, so we're going to do that series on the other side. So I'm going to place this yoga block behind her low back so that she has a tactile cue to make sure she's not shifting through the pelvis as we're doing this. We want to keep the pelvis squared forward And we'll start with hip axial rotations. So she's gonna anchor down through her right leg. She's gonna build tension in her body, and she's gonna open up her left leg, and knee is gonna find the ceiling. She's gonna lock herself into this abducted position, and she's gonna work through hip axial rotations. So we're rotating through the hip joint. She's gonna try and find her ankle towards her face from behind, coming into internal rotation, and then finding external rotation, bringing her ankle towards her face from forwards and then back into internal rotation, anchoring this knee in space, tension in the rest of the body, a couple more in each direction. Good. And then we'll transition to some knee capsule cars. So staying in this dorsiflex position, so top of the foot is up towards her face. She's gonna be rotating through this entire lower portion of her leg, and she's gonna find her foot turning inwards into internal rotation, maintaining this dorsiflex position. She's gonna turn her foot out into external rotation. Good, internal rotation. Moving through this tibia, trying to get this whole lower part of the leg moving, not just her ankle. External rotation, one more time in each direction. Good, keeping this knee in space. Now once she finds external rotation, maintaining that foot in the same position, heel is gonna find her bum. Coming into knee flexion, foot is gonna turn inwards. She's gonna straighten that leg. Tension in the rest of the body, turning her foot out into external rotation. Heel is gonna find the bum. Good, internal rotation. Moving through this entire portion of her leg, straightening. Now staying in this internal rotated position, she's gonna bring her heel back towards her bum, coming into knee flexion, turning that foot out into external rotation. She's gonna find knee extension, straightening her leg. One more time, internally rotate and straighten her leg. Good. From here, she's gonna rest for a moment as we get ready for her hip cars. So again, we want tension through the entire body. That's gonna limit the amount of compensations. I want her anchored down through her right leg. This hand is planted into the ground, supporting her. She's gonna find knee flexion, so knee finds her, or hip flexion, knee finds her face. Good, opening up, knee finds the sky into abduction, turning into internal rotation as she scoops all the way around, staying strong through her abdomen. Good, knee finds the other knee. Anchoring down through here, she's gonna kick back into extension. Good, knee finds the ceiling as she rotates through, finding hip flexion, knee comes towards the face as she comes down. That's one round. We're gonna do two here. Knee finds the face, coming into hip flexion, up to the sky. Good, internally rotate as you come all the way around, staying anchored through the rest of the body, making sure we're not shifting through the pelvis. Knee meets the other knee, anchoring down through the abdomen, kick back into extension, lifting that knee up as you find hip flexion, and then slowly coming down. Good. Taking a moment here, catch your breath, and then we're gonna transition into some Pails and Rails for hip extension. So I'm gonna get her to come into a half kneeling position. We'll work with the right leg forward and the left leg behind. I'm gonna pass her the dowel so that she can support herself with her left hand. And I'm gonna take her into her passive end range of hip extension. So what that looks like is I'm gonna get her to tuck her pelvis. So she's gonna find a posterior pelvic tilt. And then I'm keeping that posterior pelvic tilt, the left glute is engaged. I want her to shift forward until she feels a really good stretch in that front of her hip. And then I'm gonna get her to hold here. So in this position, we wanna be working to regulate our nervous system. So I want her to be focusing on her breath. We're gonna stay here for about 1.5 minutes. Inhaling on a 4 count, exhaling on an 8 count. And I'll explain the Pails and Rails. So the Pails, she's just gonna stay in this passive stretch while I do that. Her Pails contraction is her gonna be imagining there's a kettlebell or a weight in front of her knee. Her Pails contraction is going to be driving her knee into the ground and trying to push the kettlebell forwards. And her Rails contraction is going to be her driving her knee down into the ground and trying to pull away from the kettlebell while maintaining this posterior pelvic tilt and the glute engaged. So I'll get her to start irradiating through the rest of her body. So tension in her body, and at 10% effort, I want her to start driving her knee into the ground and trying to push that kettlebell forwards, ramping that up to 20% effort, 40% effort, 60%. The rest of the body should be matching the contraction, up to 80% effort, 100% effort. Hold here, driving that knee down and forwards for 5, 4, 3, 2, 1. Now 100% effort goes into driving that knee down and trying to pull it away from the dowel, maxing out hip extension, maintaining that posterior pelvic tilt. Hold the contraction for 5, 4, 3, 2, 1. Good. Slowly releasing the contraction, seeing if you can sink a little bit deeper into that stretch, and just taking a couple of breaths here. From here, we're going to transition into some hamstring Pails and Rails. So what I want to do is a quick test to see how much active knee flexion she has here. So driving that knee down, I want her to get her to lift her foot off of the ground. And then I'm going to close the gap here. So I'm going to put a couple of blocks. And this is where she's going to be working from her Pails and Rails. So I'll get her to lower her foot. Her Pails contraction, she still wants to maintain that posterior pelvic tilt and that glute engaged. Her Pails contraction is her going to be driving the top of her foot into the yoga blocks, and her Rails contraction, without shifting forward in the body, is going to be trying to lift her foot off of the yoga blocks. So we're going to start building tension in our body. And at 10% effort, I want her to start driving that foot into the yoga block, driving that dowel down into the ground, tension in the rest of the body, up to 40% effort, 60%, 80%, 100% effort. Hold here for 5, 4, 3, 2, 1. Now staying stable through here. 100% effort goes into lifting that foot off of the yoga block, holding here for 5, 4, 3, 2, 1. Good. Slowly lowering down, taking a couple breaths here, and then we're going to transition to the other side. So we'll get her left knee forward, right leg behind, and we'll start with that hip extension Pails and Rails. If you want to do 2 rounds of the Pails and Rails, you're welcome to. You can just pause the video. So here we're going to find that posterior pelvic tilt, so tucking her tailbone under, keeping that pelvis tucked and the glute engaged. She's going to shift forward, finding her passive end range of hip extension, and then she's going to hold here. Foot can be in a dorsiflex position or plantar flexed, whatever feels more comfortable for you. And here she's working on regulating her nervous system, so taking a few big breaths here before we get into our Pails and Rails. This is a really great exercise to build strength and mobility in hip flexors because of sedentary lifestyle. Sitting typically shortens these muscles, and what we want to do is we want to bring some length back, but we also want to strengthen in this position. So this is a really, really wonderful exercise to do that. So I'm going to get her to start her second round of Pails and Rails. So maintaining that posterior pelvic tilt, glute is engaged, 10% effort. She's going to be driving her knee down and forwards, trying to push an imaginary object or an object forwards, ramping up to 20%, 40%, 60, 80% effort. All the way up to 100, she's going to hold here for 5, 4, 3, 2, 1. Now driving that knee down into the ground and trying to move away from the object. 100% effort here. Driving that dowel into the ground. She's going to hold for 5, 4, 3, 2, 1. Good. Slowly releasing the contraction, seeing if she can sink a little bit deeper into hip extension. Taking a couple of breaths here. Okay, so here we're going to transition to our hamstring pails and rails. So I'm just going to do a quick test to see how much active range she has. So I'm going to get her to lift her foot off of the ground. Good, and I'm going to place a couple blocks here just to close the gap. I'm going to get her to still maintain that posterior pelvic tilt, strong through the abdomen, driving that dowel into the ground. For the Pails contraction, as a reminder, she's going to be driving her foot into the yoga block. Her rails contraction is going to be lifting her foot off of the yoga block. Cramping is common here. It's just neurological confusion, so try and work through it. So I'm going to get her to start ramping up tension in her body, and at 10% effort, I want her to start driving the top of her foot into that yoga block, ramping that up to 20%. 40, 60, 80, 100% effort. Everything she has goes into driving that foot down. Dowel is driving into the ground, holding that contraction for 5, 4, 3, 2, 1. Now without shifting forward, she's going to lift that foot off with 100% effort, holding for 5, 4, 3, 2, 1. Good. Slowly releasing down, taking a couple of breaths here. And just to finish off this little series, we're going to be doing some passive range liftoffs for hip extension. So there's a couple of different options. We'll do this in a collapsed quadruped position, and depending on your mobility, we'll give you a couple of different options. The hardest option would be her in a collapsed quadruped, and with her flexed, I'll get you to show it. So I'll get her to come into a collapsed quadruped position. One of her legs is going to straighten, so we'll get you to straighten that right leg. The hardest option would be this foot staying flat on the ground, the top of your foot staying in plantar flexion. If this is too challenging and you're not able to lift off of the ground with a straight leg, then come up into a dorsiflex position. And if this is too much and you're getting some pinching in the hip and it's too much hip flexion for you, you can either put a block or a pillow in between there, or what you can do is you can shift up even higher onto your hands and just take out the level of hip flexion here and see how much lift you can get off. So we'll do a little bit of a test here. A really common compensation is when you're doing the lift-offs to shift forward. Exactly. So what we want to do is we want to really anchor down, strong through the rest of our body. We're driving those forearms into the ground, and we're just trying to move from our hip here. We're not hinging in the low back. And so this seems to be a good position for Leah to work with. So we'll do a couple of lift-offs here. So I'm going to get her to build tension in her entire body, irradiating. And she's going to lift off with a straight leg and hold for 5, 4, 3, 2, 1. Good. Slowly lower down with control. Build tension in the body again. Get ready for your next round. Lifting off with a straight leg and hold for 5, 4, 3, 2, 1. Slowly decelerating down. We'll do one more on this side. So anchoring down through the rest of her body, she's going to lift off and hold for 5, 4, 3, 2, 1. Good. Slowly lower down with control. We'll switch sides. So there might be a discrepancy from each side, so figure out the position. You can do a little bit of a test to see what position you're able to just lift off a little bit. If you're clearing a lot of ground, then try one of the progressions. You should be able to just barely lift off here. So again, she's going to anchor down. We're making sure she's not shifting forward as we're doing this. We're just isolating hip extension here. So she's going to anchor down through the rest of her body and lift off and hold for 5, 4, 3, 2, 1. Slowly lower down. Make sure she builds tension in her body again, getting ready for the second round. Lift off and hold for 5, 4, 3, 2, 1. Slowly lowering down with control, making sure her leg stays straight. Again, if this is too much hip flexion for this hip, you can put a pillow here. So she's going to anchor down through the rest of her body, engage her glute and lift off and hold for 5, 4, 3, 2, 1. Slowly lowering down with control. Good. So that is the end of our little series. It would be wise to take a few minutes and do some breathing. You can down-regulate the nervous system by extending your exhales, so inhaling on a 4 count, exhaling on an 8 count. I would suggest spending 5 or 10 minutes focusing on some stillness and some breathing. Stay tuned for more.